What to do if you think you have post-traumatic stress disorder, PTSD. If you think you may be experiencing post-traumatic stress disorder, PTSD, it's important to acknowledge that your feelings and experiences are valid, and that help is available. PTSD is a mental health condition that can develop after experiencing or witnessing a traumatic event, such as combat, sexual assault, physical abuse, natural disasters, or any event that evokes intense fear, helplessness, or horror. PTSD can significantly impact your daily life, relationships, and emotional well-being, but it is treatable. In this article, we will outline the steps you should take if you suspect you have PTSD, including recognizing the symptoms, seeking professional help, and learning about effective treatments that can help you manage and recover from the condition. 1. Recognize the symptoms of PTSD. The first step in addressing PTSD is to understand and recognize the symptoms. PTSD symptoms generally fall into 4 categories: re-experiencing, avoidance, negative mood and thoughts, and hyperarousal. Common symptoms of PTSD include re-experiencing the trauma. This includes flashbacks, nightmares, or intrusive thoughts about the traumatic event. You might feel as though you are reliving the trauma, even when you are in a safe environment. Avoidance. People with PTSD may avoid reminders of the trauma, including places, people, or activities that may trigger memories. They might also avoid talking about the event or thinking about it. Negative mood and thoughts. Individuals with PTSD often have persistent negative emotions, such as guilt, shame, or hopelessness. They may feel detached from others or have difficulty feeling positive emotions. Hyperarousal. This refers to a state of increased alertness, making you easily startled, irritable, or having trouble sleeping. You may also experience difficulty concentrating or have outbursts of anger. If you recognize these symptoms in yourself, it could indicate that you are struggling with PTSD. It's important to remember that these symptoms may not show up right after the trauma, and they might surface months or even years later. Key insight: recognizing the symptoms of PTSD is the first step in taking action. If you identify with these experiences, it's important to seek help as soon as possible. 2. Talk to a mental health professional. If you believe you might have PTSD, the next step is to reach out to a mental health professional. A licensed therapist, psychologist, or psychiatrist can help you understand your symptoms, confirm the diagnosis, and discuss treatment options. PTSD is a condition that can significantly benefit from professional intervention. Steps to take: schedule an appointment. If you're unsure where to start, begin by scheduling a visit with your primary care doctor. They can refer you to a mental health professional with experience in treating PTSD. Seek a therapist specializing in trauma. Many therapists and psychologists specialize in trauma-focused therapies, such as cognitive behavioral therapy, CBT, or a movement desensitization and reprocessing, EMDR, both of which have been proven effective for treating PTSD. Prepare for the appointment. During your appointment, be honest about your symptoms and experiences. It may be helpful to keep a journal of your thoughts, feelings, and any triggers you encounter leading up to your session, so you can provide more information to the therapist. Key insight: a mental health professional can guide you through the process of understanding and managing your PTSD symptoms, providing you with the tools and strategies necessary for recovery. 3. Consider treatment options. Once you've connected with a professional, you'll discuss the treatment options available to help manage your PTSD symptoms. There are several effective treatments that can help individuals with PTSD, including therapy, medication, and self-care strategies. Therapy options: cognitive behavioral therapy, CBT. CBT is a structured therapy that helps you identify and change negative thought patterns. Specifically for PTSD, trauma-focused CBT can help you process and reframe your thoughts about the traumatic event. A movement desensitization and reprocessing, EMDR. EMDR helps individuals process traumatic memories by using guided eye movements. This method aims to reduce the emotional intensity of traumatic memories and help you reprocess them in a healthier way. Prolonged exposure therapy, PE. This therapy involves gradually confronting and processing memories of the trauma in a safe, controlled environment. It helps reduce the distress associated with the traumatic memory over time. Medication. Antidepressants, medications like selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed for individuals with PTSD, especially those who experience depression and anxiety alongside the condition. These medications can help regulate mood and reduce anxiety. Anti-anxiety medications, for individuals with significant anxiety or hyperarousal symptoms, anti-anxiety medications like benzodiazepines may be prescribed for short-term relief. However, these medications are usually used with caution due to their potential for dependence. Sleep aids, if sleep disturbances, such as nightmares or insomnia, are significant, medications like prazosin can be prescribed to help improve sleep quality. Self-care and lifestyle strategies. Exercise, regular physical activity can help reduce anxiety and stress, improve mood, and enhance sleep quality. Mindfulness and relaxation, practices such as yoga, meditation, and deep breathing can help calm the mind, reduce hyperarousal, and improve emotional regulation. Building a support network, surrounding yourself with supportive friends, family, and loved ones can provide emotional strength and a safe space for healing. Key insight: there are a variety of treatment options available, including therapy, medications, and self-care strategies. Working with a professional will help you determine the most effective treatment plan for you. 4. Reach out for support. Having a support system is an essential part of managing PTSD. Sharing your experiences with trusted friends, family members, or support groups can provide you with a sense of community and understanding. Ways to build support. Talk to close family or friends. Let the people closest to you know about your PTSD and how they can support you. It may help them understand your emotions and reactions better. Join a support group. Support groups for PTSD provide a safe environment where individuals can share experiences and coping strategies. It can be reassuring to hear from others who understand what you're going through. Online resources. If in-person groups aren't available or you prefer anonymity, there are online communities and forums where you can connect with others experiencing PTSD. Key insight: support from others, whether through family, friends, or a support group, is crucial for recovery and maintaining emotional well-being. 5. Practice patience with yourself. Recovering from PTSD takes time, and it's important to be patient with yourself throughout the process. Healing is not linear, and setbacks are a normal part of recovery. Some days will feel better than others, and that's okay. Tips for practicing self-compassion. Take it one step at a time, focus on small goals each day. Whether it's getting out of bed, practicing deep breathing, or reaching out for support, every step counts. Celebrate progress, even small improvements are a sign of progress. Recognize and celebrate your achievements, no matter how small they may seem. Be gentle with yourself. PTSD can make you feel overwhelmed or defeated at times, but it's important to remind yourself that you're taking active steps toward healing. Show yourself kindness and patience. Key insight: self-compassion is a key part of healing from PTSD. Progress takes time, and it's important to honor your journey, no matter how long it takes. Conclusion: if you think you might have post-traumatic stress disorder, PTSD, the most important thing is to acknowledge your symptoms and take the necessary steps to seek help. Whether it's reaching out to a mental health professional, exploring treatment options, or building a support network, taking action can help you manage symptoms and improve your quality of life. PTSD is a complex condition, but with the right treatment and support, recovery is possible. You are not alone, and there are resources available to help you heal and move forward.